The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Once again, folks, welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and a Saturday, we get together and talk about all things related to your health. And this time, we're talking about what I considered one of the most important parts of your body, the kidney. And we're talking about World Kidney Day. It's a worldwide campaign to raise awareness about the importance of kidneys and their functions. And I have with me a panel of experts in all aspects. Go ahead and introduce yourself, please.
My name is Erlin McLeod, the nurse manager for the dialysis department at the Health Services Authority.
Hi, my name is Anyelka Rankin, and I am now a kidney transplant recipient.
Good afternoon to all listeners. My name is Dr. Racquel Lowe-Jones. I'm the consultant nephrologist at the HSA.
And as I said earlier, we're talking about the importance of World Kidney Day. Now, I want to say this is taking part on March 14th of this year. And the initiative is, I think, what we need to all strive for, preventive behavior. Tell me a little bit about that, ladies.
Well, certainly prevention is better than cure. And we all know that trying to prevent disease is the best way going forward. Unfortunately, about 850 million people worldwide have kidney disease, and about 3.1 million of those have died since 2019. So it's really, in my words, a pandemic. And so if it is a pandemic, we need to curb this pandemic. And one of the most important things is to prevent kidney disease. Now, that also depends on the cause, because there's many causes of kidney disease and kidney failure. So we have to tackle the cause of what promotes kidney disease. And some of the most common causes are hypertension that is uncontrolled and diabetes uncontrolled. So those are the two red herrings. So if we have good control of those two diseases, that could help with prevention and progression of kidney disease.
Do you find that because of our region, we are more systemic to these types of problems? You know, as always, I talk about our West Indian diet and the heat and all of those types of things. Do they play a part into this overall, doctor?
Well, certainly African Americans and black persons or Afro-Caribbeans have worse outcomes with kidney disease because inherently their hypertension and their diabetes are also not adequately controlled. And so we see that blacks on a whole really have worse outcomes than other ethnicities.
Understandable. So let's start with realistically the importance of this day. We talk about preventative is definitely the cure. And nurse, if you can explain to me a little bit about what we're doing for World Kidney Day.
Usually every year we have a worldwide awareness to celebrate that, raising, doing public screening. At the HSA every year we do public screening. We start in the morning, 7:30 until 12:30. During this time, we check blood pressure for persons, we check the sugars, we check the weight and the height, because obesity is another factor that contributes to the kidney disease, also to have elevated blood pressures. So we have an on-site nutritionist, we have on-site doctor who those persons who BMI is high, those persons who the blood pressure is high, those persons who the sugar levels is high, is being reviewed by the dietitian and the doctor and being referred to our clinics at free cost. So this is a way to prevent the progression and so the public can be aware what to look for.
Understandable. And we're going to take a quick first break, folks. We're just getting started. We're talking about World Kidney Day, which is bringing awareness and also changing the preventive behavior and bringing the risk factors as what it takes to deal and live with kidney disorder. This is happening on March 14th. So we'll take 2 minutes and be right back. Welcome to Healthcare Today with the HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking about World Kidney Day that's happening on Thursday, March 14th. Now, this is something I want to say is worldwide because we have encompassing all of the globe, and we are happy to be part of it. Compliments of our friends over here at the HSA. If you can talk to me a little bit about what we're doing on that specific day. I don't know if the doctor or nurse want to talk to us about what we're doing on that specific day.
On that day, we will have a free health screening for the public. We will be having the blood pressures, glucose check, weight and the height. We will have a dietitian on site. We will have a doctor on site who can review our normal results. The time will be from 7:30 to 12:30, so we encourage everyone to come in and have their checks. Sometimes this helps to be aware that you have it and prevent it to progress it.
Exactly. And folks, this is be happening in the atrium at the front of the hospital over the HSA. Make sure you get there early because there's always, you have to take into consideration, folks, you're going to get your blood pressure check, your glucose level, as she said, your cholesterol check, and it takes a little bit of time. So make sure you get there early and be able to spend, a little bit of time there because we want the best and accurate results. Because I know you're rushing and you may be winded. You got to calm down and you're seeing the doctor and things will go from there.
I would like to add to that we will also be having a continuing medical education program in the evening, starting at 5 to 7 p.m. for our medical professionals, not just at the HSA, but island-wide. And we will be having multiple speakers that really encompasses kidney care. And that includes a dietitian, the pharmacist, because part of the theme this year is optimizing pharmacological practice. So we want to highlight some of the pharmacological implications in patients with kidney disease. We also will be having Dr. Sharp, Natalie Sharp from Jasmine, who will be talking about conservative management in kidney disease. And that's an area that, is a bit touchy-feely, and I think that it would be important for our healthcare providers to understand that conservative management is another option in patients who have advanced kidney disease. Mm-hmm. We'll also be having a patient that day to give her views on, patient perspectives on living with kidney disease. So I encourage all of our healthcare professionals and hopefully open to the public to come to the Hibiscus Lounge at the hospital from 5 to 7 to learn about different aspects of kidney care management.
Exactly, and I think this is very important. It's a good way to bring in practitioners and also people who have, I call it a stake into it, because maybe you have some family member that's living with this disorder, or maybe you yourself have recently been diagnosed with it and trying to get a grasp on it to try to understand it. Speaking of that, I have with me here, I want to call her a patient within it, but also somebody who has walked the path of it. Tell me a little bit about your journey with your kidney disorder.
Okay, so I was diagnosed as a CKD patient at a very young age, I believe at the age of 8 years old.
What's CKD?
Yes, chronic kidney disease.
Okay.
Yes. So at that age, I was given steroids for management treatments. And I went into remission over a few years, around the age of I would say, 13 to 14. I did have a relapse around the age of 16, and then I would say around the age of 24 is when I was told that I would need to start dialysis, that I was going through end-of-stage renal failure.
Okay. That's a very long time to be living with this disorder. Initially, you're thinking like, oh, I'm a child. Of course, you're having people help you manage it. Then you start to do it on your own. Tell me a little bit about that transition.
So being a child growing up, my parents normally would have taken the reins, and we had to do a huge life adjustment with my eating habits in particular. So I can vaguely remember at that time that I had to cut out salt, a very low sodium diet that I had to be put on. Also, it was a low protein diet because for my particular condition, I was spilling a lot of protein in my urine.
Okay.
Fast forward from that, being a teenager, you know, you want to venture out on your own. I did continue with my particular diet growing up that was instilled in me, but I also wanted to be adventurous and try new things, as in food-wise, you know. And unfortunately, what made me relapse was I ended up having a food poisoning.
Oh, okay.
Yes.
So something completely not attributing to the sickness caused the sickness to be triggered.
Well, that's what we assumed.
Okay.
But that's what caused it, was a food poisoning. At the age of, I would say, 21, I did go for a checkup, and it was a decline in my kidney function, and I was put on steroids to try and boost my kidney function back up, but that did not help at the time. My kidney function was declining rapidly, and at the age of 24 is when I started dialysis, which was a very serious, life-changing element.
Wow.
Yes.
So let me just make a shift now. You brought in a word that most people probably have heard but don't know too much about, dialysis. What is dialysis? And if the doctor or nurse can chime in, what does it consist of and how does it help?
So dialysis is a procedure that patients undertake when their kidneys can no longer do their jobs. And one of the most important jobs is to clear the blood of toxins. When the patient reaches that stage where they're unable to clear the toxins, we have to clear it for them. And we do that artificially through a procedure called dialysis. Now, most persons may know heard of the term hemodialysis, but that is just one modality of dialysis, and that is dialysis through the blood. The other modality is called peritoneal dialysis, where a tube is inserted within the abdomen, and so that is another way of doing dialysis. But both modalities, the whole point is to clear the body of the toxins, to help decrease potassium, to improve acid balance in the blood, and to overall help sustain life, because dialysis is a procedure to sustain your life because the kidneys are no longer functioning.
And because of that, would that help like keep the electrolyte level and the fluids basically moving? Because from how you're talking, what I'm understanding is that the kidneys have ceased to function at optimal level, which means that they may be 10%, 15, maybe 20, 30, but they cannot sustain the full body. Am I correct in saying that, doctor?
That is absolutely correct. Chuck, can I call you Chuck?
Yes, you can call me Chuck. Yes, you call me Chuck.
Absolutely. So you hit it on the nose. So the kidneys have multiple functions, and it's not just to clean the body of toxins, but as you said, it's to regulate the electrolytes in your body. One of the most important electrolytes is potassium. So that is why, our patient here, Neilka, she had to go on certain food restrictions, and one of those food restrictions is a low potassium diet because you're unable to pass that potassium out in your urine. Phosphorus is another very important electrolyte. Patients are not able to get rid of the phosphorus, and ironically the machine doesn't get rid of the phosphorus as well either. So patients have to be on certain phosphorus medications to help bind the phosphorus, the excessive phosphorus in the blood, to help rid their body of phosphorus through stool. So it is, as she said, a life-altering
It sounds,
procedure.
and we're able to do this on island here at the HSA.
So definitely, and I'll have Nurse Erlin speak more to what we offer at the HSA in terms of hemodialysis.
We offer hemodialysis service to all patients who have end-stage kidney disease, in stage 5. At this time, the kidney function is not there to remove the toxin level. The patients, most of the times, based on their conditions, the doctor prescribes every other day dialysis, be coming to the unit every other day to have their sessions. Mostly the sessions is between 3.5 hours to 4 hours to clean the blood. The persons have to have an dialysis access in order for that to happen. That is created before starting the process, and that is how the doctor mentioned is to sustain the life of the person. And the other part is the restrictions, the nutrition, compliance with the medications, help them to sustain their life.
Bear with me for a second. For a person in their 20s, living life and being told that every other day I need to go to a medical facility, a hospital, somewhere, and have this procedure done is mind-altering, to say the least.
Yes, it is.
How did you cope with that?
So at first, when I first started dialysis, it was very shocking. I was very nervous and scared all the time. I did cry a lot. I always needed someone in the room with me while I did dialysis, or next to me while in my chair, because we're hooked up to a machine. And at that time, my treatments used to last for 3 hours.
Wow.
When you come to dialysis, just to give you a clear picture, you weigh yourself, and that's known as your dry weight, or the weight that you come in. Sorry, not your dry weight. The weight that you come in, it's calculated in a way that when you go on the machine pulls off a certain amount of fluid to bring you down to your dry weight.
Oh, okay.
Yes. I mean, the nurse Erlin and Dr. Lowe-Jones can, clarify that more. I haven't been to dialysis in a long time.
Okay.
But yeah, it's very it's a very gruesome experience in some senses, because you lie there, you can either go to sleep, watch TV, read a book. You have to be still, pretty much.
You have to be still. That's what I was just about to say. You can't be up and down.
Yes. I started with a chest catheter, and I had that in me for a year. And then I was moved to a fistula at the time in my right arm, and that's where I continued to do dialysis.
Okay.
A fistula is where they take a regular vein and a main artery and connect it as a huge vein in order to...
So you have an in and out?
No.
Oh, okay, yes, but they come out of your arm to the machine.
No.
Yes,
well,
they cannulate the fistula with needles.
Okay.
Yeah.
Big size needles that allow to flow
Okay.
and be connected to the machine.
okay.
Yeah, I'm sorry, but my wordage is off.
Yeah.
I do exactly. So it goes to.
And referring to what she was saying about the weight, yes, it's very crucial for us to have the patient weight before, because we utilize it to calculate the total amount of fluid that we remove from the patient, considering not just the weight. If the patient have any symptoms, shortness of breath, swelling, or any other symptoms that will help us to just bring the person to the ideal way where the patient have no cramps, feel okay, the blood pressure is fine, and we take those in consideration to calculate the total fluid removal for the day.
Understandable. Okay.
And patients are being educated regarding to that, so when they arrive to the unit, they know what to do.
So with me going into my dialysis treatments, what I would personally do is, my routine was I would bring food, eat for the first hour or half an hour, and then I would listen to music and end up going to sleep, or I would watch TV. And then in no time, your treatments are finished. But you have to remember that's 3 hours out of your day that's being taken out.
Every other day.
So at that time, my routine used to be Tuesday, Thursdays, and Fridays, I would do treatments for every 3 hours. And, you know, being in your early 20s, that's a huge adjustment.
Understandable.
So
Not just that, you're asking someone else to be with you because this is scary. This is life altering and life threatening at the same time.
Yes. And I had my family members there for support and comfort, so they would take turns. My aunts and cousins and even friends would come and just sit
support
with
system
me.
is definitely a must for something like this.
It's definitely needed, yes.
Okay, folks, we're going to take a quick break and come right back. We're talking about World Kidney Day that's happening on the 14th of this month. When I come back, I'm going to ask one specific question. It's been labeled the silent killer, and I want to get an indication of why and also how, and talk some more about preventive medicine here, right? Keep it right here. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. We'll be back in 2 minutes.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. We're talking about what is CKD. Now, you may say, Chuck, what is that? We're going to get some more information because we are talking also about World Kidney Day that's happening on the 14th of March over by the HSA. They're going to be having a great time for you to stop and get checked out inside of the atrium. That's in the front from 7:30 a.m. till 12:30 p.m. Put it in your calendar. Even if you're feeling good, you should go get checked out. You know why? Because it's considered a silent killer, and I'll have the doctor explain why and give some more details about that.
Thanks, Chuck. And many times persons have heard that hypertension is a silent killer. However, kidney disease, as you said, CKD, is a silent killer. Why is that? One of the most important reasons is that kidney disease can affect you early. And in early disease, you have absolutely no symptoms. So I would like your listeners out there to realize that not every time you see persons with a swollen ankles or swollen legs, you know, by the time it reached that stage, it's quite advanced. We want to catch it early. We want to actually prevent it because kidney disease in its early stages have no symptoms. When you start to manifest symptoms, it may be too late. So that is one of the most important things. As you rightly said, even if once you have risk factors for kidney disease, such as hypertension, diabetes, obesity, even if you were prematurely born, I also want to highlight that kidney disease is not a disease of the elderly. As you can see, our Miss Anilka here today, she had kidney disease from the age of 8. So it's the entire spectrum of age. So it does not discriminate against age, right? So one of the things we really need to look out for is those persons who have risk factors. Persons who have autoimmune disease, such as lupus, rheumatoid arthritis, diseases that can affect young persons, cancers, persons who are prone to developing kidney stones. I have to give a shout out to the men out there, those over 40 or have a history of prostate disease. So these are all risk factors for kidney disease, which may not have any symptoms initially unless they're caught early. So we want to emphasize early screening if you do have risk factors for any of these conditions. And so what we like to emphasize in our clinic is the stages of kidney disease. We have 5 stages of kidney disease, 1 through 5. And so stage 1 is those persons who have over 90% kidney function. However, they may have symptoms of protein in the urine, by which the patient will be seeing bubbles or froth in their urine, such as Miss Anilka here, who had protein in her urine at a very young age. That is a very early warning sign that something is wrong. And that's stage 1. So although the numbers may look normal, and the number that we're looking at is the creatinine, which is a waste product from our muscle that we pass in the urine. The number may look normal, however, there is protein in the urine. So this is why it is a silent killer, because the doctor may say, wait a minute, the kidney function, the number looks fine, the creatinine is normal. However, if you have not checked for the protein in the urine or even done an ultrasound, because we also have structural abnormalities. Some persons have dual urinary tracts, an extra kidney. So any structural abnormality will also contribute to kidney disease.
I wanted to ask, because we assume most people, healthy people, have two kidneys, can one be malfunctioning and the other be, or does both go down the same time? Or how does that work a little bit, Doc?
So most persons are born with two kidneys, and each kidney have about 1 million very small filtering units. We call them nephrons. So we're all born with about 1 million in each kidney. And your kidneys are the size of your fist. So if you make a fist, your kidneys should be the size of your fist.
Okay.
When we do an ultrasound and we see that the kidney is small or shrunken, then we know that likely something has been going on, or they may have been born with a small kidney.
Okay.
Many times our pregnant women who having their first ultrasound for their pregnancy, they find out, my goodness, I have one of my kidneys is smaller than the other. But you have no symptoms and you can live quite fine with one kidney.
Okay.
If you're born with one kidney or born with a shrunken kidney, you can quite fine live with one.
The thing, now that you're talking more about this, you said that the small holes are called, is that, I've heard the term nephrotic syndrome, the neurosis and things of that nature. I did a little bit of research to try to get, so don't think, folks, I'm kind of putting them on the spot here because they are the professionals, but I want you to understand more so about the disorder, and then we'll talk about preventive and what to do to detect the early kidney diseases. So, Doc, tell me a little bit about those terminologies, because people heard them, because they look them up on the internet and Dr. Google and all these things, like, oh, what is this, So tell me in real time what that is.
So there's a term called nephrotic syndrome, and that is just a disorder of the kidney that basically your kidneys you're losing protein in the urine. So there are multiple causes for that. However, that's not the only cause of kidney disease. But it's a disease that we have to deal with, because the manifestations of it you can actually see when you're passing too much protein. They become patients can become very swollen. They can get swelling around the eyes. They can swelling in the feet. And if it's a young person, teenager or young adult, they carry fluid in their abdomen. And the reason why they're swelling is because their protein, which is in the blood, is leaking out through the kidneys, and you're passing it out in the urine.
Like a sieve.
Right. So the sieve isn't working. So instead of the kidneys reabsorbing the protein and bringing it back into the blood, they're passing the urine out. What causes nephrotic syndrome? As I said, there are multiple causes. Sometimes we may not find a cause, and we may have to elevate our investigations to possibly do a kidney biopsy, which is placing a needle into the kidney, or to add to that, genetic testing, because nephrotic syndrome, there are genetic causes for nephrotic syndrome as well.
And so shifting now, let's talk a little bit about one of the things that is high on the World Kidney Day stage, which is prevention is better than the cure. Let's talk about some of the early stages of CKD, because they go undetected. How can we just do some simple kidney function tests, and also what can we do to help the 8 golden rules? I read it somewhere. I said that there's 8 golden rules that we can use to help prevent kidney disease. Let's talk a little bit about that.
So prevention is extremely important, and I want to go back and focus on screening, early screening for those patients who have risk factors for kidney disease. For you to know if you have a risk factor, you have to have regular checks. So at least what I always tell my patients, on your birthday, that's the best birthday gift to yourself. Go and get an executive profile done. Blood, urine, check your heart, everything, once per year, so that you know that nothing creeps up on you. So that's one of the most important things in terms of prevention. Depending on your age-appropriate screening for certain cancers should be done. So such as for men, prostate cancer, women doing their mammograms, breast ultrasound, pap smears. So age-appropriate screening should be done. The other thing is fluid intake. We haven't spoken about fluids. Depending on the type of work you do, excessive outdoor work, agricultural work, or even if you do inside work inside an air that is you're exposed to air condition all day, you may not feel as thirsty, but you don't realize that your body is being dehydrated. Your tongue is dry, your lips are chapped, you feel thirsty. So I encourage persons to carry their water bottles to work, to drink fluids. Another thing too, very important for prevention, is if you do have one of these risk factors for kidney disease, such as hypertension, diabetes, or any autoimmune disease, please, 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 I implore you to stick to the treatment that your doctor have prescribed. Many times patients are burdened by the amount of tablets that they have, and many times kidney patients, on an average, they can take between 15 to 20 different tablets per day.
15 to 20?
Many tablets, especially, and it gets worse as you get older, as the kidney function declines. So, and it's a pill burden is a real thing for patients, and we try to explain to them, space them out. Those that are taken once a day, you don't have to take it in the morning with your morning tablets. You can take it in the afternoon to give yourself a break. So these are some of the things. Dietary considerations are very important. We know that salt contributes adversely to kidney disease and hypertension.
Doc, I'll just pause right there, folks. If you can throw away the salt shaker in your kitchen, go ahead and do it. The salt already is in tons of food.
Yes.
You don't need any more. That's always been my pet peeve. I haven't used salt in about 20 years because it was just already in everything I was eating.
It's in everything. It's in everything. And the fast food doesn't help because those are highly added preservative salts with a lot of preservatives and salt additives. So they may be very tasty. However, the fast food does not contribute to a healthy.
We're going for longevity here, folks.
Definitely.
Longevity.
Definitely. The extreme fats in the diet that we get, the cholesterol, also can contribute to obesity. We do have something called obesity-associated nephropathy, where obesity can adversely affect the kidneys. So generally, a lifestyle, overall lifestyle management is very important to stave off the effects of kidney disease.
And I just wanted to add into it, folks, I know we West Indian, and this has been tabooed in many of our cultures. Talk about your family history. Get to know who may have been sick in the past, grandpa, uncle, auntie. We have a tendency not to talk about our family history when it comes to sickness, but this is a clear indication of things that could possibly happen to you, your children in the future. So it's good to have that knowledge of a background base of, say, so-and-so wasn't diagnosed with it, but their feet was always swollen. Well, that's an indication that something was the matter. Those little things are definitely one of the high risk factors that I say is knowing your family history. Doc, I wanted to talk just about two things about the quality of life being affected from having been told you have CKD. With that, I mean, we talk about the treatment, we talk about that. Just give me a little indication about that.
Well, the quality of life depends on the stage of kidney disease. As again, if it's very early disease, patients may not know that they have kidney disease, and they may not change their lifestyle for the better. So where the quality of life issue really comes in when the burden of kidney disease the patient becomes quite symptomatic. And these are more seen in patients with advanced disease, where they're passing less urine, and as they pass less urine, they're not able to tolerate drinking more fluid because the fluid has nowhere to go. Also, a lot of these patients, one of the most common cause of death in patients with kidney disease is cardiac disease. And so you may have two organs going at the same time, heart failure and kidney failure. And so
at the same time?
At the same time, because the heart and the kidneys are intimately entwined. They work in balancing salt and fluid within the body. And so if one is bad, it will affect the other, and vice versa.
So you can have a stroke, you can have multiple things happen because of one disorder affecting another, then affecting it, almost a domino effect.
That is correct. And unfortunately, the kidney gets hit in all of that. So once you have organ disease in one organ, it can definitely affect the kidneys. So the quality of life really depends upon the stage. So if it's a patient who have stage 3 disease, these are persons where their kidney function is less than 60%. They may start to feel more fatigued. They don't have the energy. They may not be able to concentrate as much. Very subtle signs. Some patients may exhibit itching on their skin because the toxins are building up underneath the skin. Again, they may find issues with their urinary stream. They're not passing as much urine. The urine may be frothy. They may see it more dark. So, it really depends.
There may be blood in the urine.
There may be blood in the urine. Okay. So it depends upon the stage of the kidney disease. But certainly advanced kidney disease will definitely affect your quality of life.
Understandable. Folks, we're going to take a quick break and come right back, and I'll ask our panel about the treatments of the dialysis treatments that's offered over at the HSA. And also, before we wrap up, I definitely want to talk about what advice they would give the public who is thinking, oh, I'm fine. We're going to discuss that. We'll be right back. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m. we get together and talk about all things related to your health. And this time we're talking about World Kidney Day that's happening on the 14th of this month. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we are talking about World Kidney Day that's happening on the 14th of this month right here, and being basically celebrating life with the HSA, and also how you can avoid coming down. And I wouldn't say coming down, because there's a lot of factors to kidney disease, and I think that the most important thing is that you get yourself checked out as soon as possible. That, to me, sounds like a plus to your welfare, your health, your well-being as a total. We were talking right before the break about dialysis and dialysis treatment available over at the HSA.
The dialysis service in the HSA provide care for all patients with the stage 5 kidney disease. That's the last stage, meaning that the kidney function is no longer there to remove the waste product of the system, to remove the excess of fluid, to remove those toxins that the person build up in the system after they eat, when they metabolize the food that they eat and drink. So dialysis is a procedure that we use an artificial kidney, they call it the dialyzer, and that process in the blood remove these toxins. So the patient come in every other day for 3.5, 4 hours, and that filter in the blood, removing the excess fluid, and the patient sustain the life for the patients.
Exactly. And this is a service available at Faith Hospital and in HSA in town here?
Yes, it is. So we do have 2 dialysis units, one at the main hospital, and we also have on Cayman Brack, we have 1 chair there. And I want to say, Chuck, that the numbers are increasing in the amount of persons starting dialysis. We've also opened up a small unit in West Bay at the West Bay Health Center. Mm-hmm. And so that is part of promoting community dialysis. So taking the patients out of the hospital, right, and reserving the hospital really for acute patients, meaning patients with emergent issues.
Right.
Right? Because our dialysis patients, they are not sick per se. They're coming for a treatment.
Right. And that can be done in
the community.
Or in their district. Right.
All right. And that is what we hope to help with by community dialysis.
Exactly. And so give me some of the therapy and the hemofiltrations that you will be, that patients go through during their dialysis procedure.
Hemodialysis is one modality for doing the dialysis treatments that use the blood. So patients are connected on the machine through a line or a catheter and pull the blood from the body, goes to the machine, processing the dialyzer, and go back to the patient like a cycle base. So the machine is setting, the dialysis machine are set for the time that is prescribed by the physician and set with the total amount of fluid that we need to remove, and that's do the job. Okay. So we monitor the patient during the procedure and everything is recorded. The peritoneal dialysis is another modality of doing the dialysis. Both modalities remove the toxins of the body, reducing the amount of fluid that the patient has to sustain their life and enhance the quality of life. So peritoneal dialysis, it can be done at home. Patients are trained for doing that modality. They can do it manual exchange, or they could do automatic exchange with the machine. That is provided to the patient, and
so there are options for that.
Yes. So the patient is being trained to do that modality.
And I think that's a great way to look at it, because you're taking charge of your life also. You're giving an opportunity to be productive of your own health, because I think right now we're at a stage, and this may just be the world, that we want more say in what happens to us. So if I know that rather than going to the HSA, I love you guys, but I can do it at home and be taken care of and understand what it means to do it properly, then sure, why not? Why wouldn't I take advantage of that?
And to tell you the truth, Chuck, that's the way of dialysis in the world. The U.S. is pushing home dialysis on a national scale, and we really want the patients to be autonomous in their care, allow them to have a life, and not have them confined to inpatient care. And so, home dialysis, whether it's through the blood or through the abdomen, are real options that many patients abroad are using, and is something that it would be good to introduce in the Cayman Islands, to have the patient dialyze in the comforts of their home at their own pace on their time.
Would you consider that a more holistic approach to patient care?
Absolutely. The patient is they're not just a clinical entity. They have a mind, body, and soul. And so we should be mindful that we're treating the biopsychosocial aspect of the patient, not just the clinical aspect. We're not just looking at the blood numbers. Because as Anilka just said, it's a mind, it's a body and mind altering and a whole life altering diagnosis when you have advanced kidney disease. Yeah. And so having the comforts, in your own home, doing your procedures, having the dialysis done, would make a world of difference.
And of course, you can always get checked out later with the nutritionist, the pharmacist. There is a complete team around you to give you support to get to the stage that you really need to be, which is managing and taking care the best you can of yourself. Because if you feel bad one day, you can always reach out to them. But if you need to do something, you don't need to drive an hour. I'm just saying traffic here, an hour to get to town, another 3 hours, and then maybe half an hour to get home. That's a full day for some people.
Absolutely. And if we can help patients in that way, and remember, even if we do reach the stage where we can dialyze patients at home, they're not left on their own. They would have to go through an intense training process with the help of the nurse, the doctor, the nephrologist, myself. And they're trained up to a point where they can do it. If they can do it comfortably on their own, then they're also observed at home with our dialysis nurse. So at no point in time would the patient be left on alone.
Their own. Okay, yeah. Excellent. Before we start wrapping up here, I wanted to talk a little bit about transplants. We've been, and mind you, I'm a TV watcher, some time of health programs, and there seems to be a lot more talk about that, a lot more scientific evidence changing people's thoughts, and also I want to say progression of technology when it comes down to transplants. Doc, give me a little bit more information about that.
So kidney transplant is the cure for kidney failure, not dialysis. And so the public needs to realize that once your kidney function have dropped to a level where it cannot sustain itself, we have some patients, we bypass dialysis and we send them for workup for kidney transplant as long as they continue to pass urine. So kidney transplantation is basically a surgical procedure that we identify patients who are candidates for a kidney transplant, which entails either receiving a kidney from a living donor, meaning someone alive. It could be a relative, it could be a stranger. As long as the blood and the tissue types match, they can donate a kidney to you. Because as I said earlier, you can live with one kidney.
Okay.
The other option is what we call deceased donor, where someone who's deceased, either brain dead or cardiac death, and those patients, we would get the kidney from a deceased donor.
Okay.
And both kidneys, full workup to see if the kidney is optimal for the patient receiving the kidney is done. It's tested for all infections, and it is definitely an option that we want all of our advanced kidney patients to entertain, to receive, because we don't want them to be stuck on the machine for the rest of their life.
Right. Understandable. We're going to take our last break, and when I come back, we're going to talk about and experiencing what it means to live with CKD. And also, I'd like the panel to basically give advice to our listening audience individually of what best to do to avoid kidney disorder and disease, and also what to do if you're living with it. We'll take 2 minutes and be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking about World Kidney Day that is happening on Thursday, the 14th of this month. And we're basically highlighting the importance of preventive behavior, awareness of risk factors as it deals with living with kidney disease. And my panel of guests here, we've been talking extensively about it, but I wanted to kind of narrow it down with a person who is living and breathing and dealing with this disorder every day. I don't want to make you laugh, but you're a real testament of what it takes to basically get up every morning and deal with this.
Yes. So yeah, I do take a lot of tablets to maintain my kidney transplant that I received. I will be going on to my third year in April with my kidney transplant.
Congratulations.
Thank you very much. I also received a deceased donor.
Okay.
So yeah, my deceased donor was a male, just a pretty simple background right there. And we're given a little minor detail of the person.
Okay.
When we are selected for the transplant surgery, once a kidney becomes available that matches your blood and your tissue and some other testings that they have to do. When that day came for me, I received a call and
It happened pretty fast?
well, I was on dialysis for 5 years and 8 months to be exactly.
So it wasn't pretty fast?
It was not fast. It took some time because it's a workup that you have to do in order to get on the transplant list. And it's a team that once you go overseas for your transplant, they decide, if you're capable to live a life with the kidney that you received. Unfortunately, I was. And I decided to move to the States just for a few months because I did receive at least 2 or 3 calls prior within a space of, I would say, 3 months, in a span of 3 months, of an available kidney. But due to the fact that I was in Cayman and I couldn't...
I was going to ask that.
Yes. So due to the fact that I was in Cayman, I couldn't reach to Florida in time
to receive it.
To receive the kidney. So I ended up losing that opportunity. So both my mom and I decided, let's move to the States for 4 months. And as I moved there, I did my dialysis treatment for a week. And on Wednesday, the 28th of April, is when I received my kidney.
That to me sounds so surreal.
Yes. It happens quickly once you get that call, because you do also have a choice of declining the offer of the kidney or accepting.
Oh, okay.
Yes.
So the choice really is yours when it comes down to it.
Yes.
But then if you decline it, they have to move to number B or C or whoever it is quickly.
Yes, because the kidney is only viable on ice for a certain period of time. And they give you a time limit. Once you accept that kidney, they give you a time limit in order to reach to the hospital where that kidney is at, in order to be prepped for your last dialysis treatment and also for surgery. So for me, I can remember that night very clearly. I received my first call around 8 o'clock. And then I would say minutes to 12, I got my second call asking if I accepted, which I did. And then by 1 o'clock, I was at the emergency unit at Cleveland Clinic Hospital in Weston, Florida. And I did my last dialysis treatment at 3 in the morning, 3 till 6 a.m. And then I was pushed into the OR at 7. So I didn't sleep that whole entire night.
So within 8 to 10 hours from start to finish. Well, start to surgery.
Yes, and the surgery, I believe, lasts at least 4 or 5 hours.
Wow.
Yes, and that's without any complications. And then I came out of surgery, recovered. At that time, it was COVID. COVID was still at its rampant.
I was just about to say, you said 3 years, and so we're in the height of the pandemic.
Yes. So I did my surgery. It was a Wednesday night, Thursday morning. So by Thursday in the afternoon, I was in recovery. By Friday morning, I was told I needed to be up and sat in a recliner chair to feel if I'm comfortable. Once I was comfortable, within, I would say, an hour or so, they told me I needed to walk around the unit. If I walked around the unit without any pain or any...
You had to go home?
Yes, I had to go home. And I aced that with flying colors, and I was sent home by Friday midday.
You must have been ecstatic.
It was a lot to grasp in a very short amount of time. I just went with the flow and was very positive.
You should write a book.
I was told that many times.
I'm literally listening to you, and I'm sure my audience is thinking, not just having a having a kidney transplant, but the journey, because it's not like someone being told, oh, I'm 35 and I need a kidney transplant, and they find one within 3 or 5 years. We're talking 20 plus years that you have been walking this path.
Yeah. I mean, it's a lot to handle. And being a transplant recipient now, I'm still learning and still grasping what comes my way. And with the help of Dr. Lowe-Jones and my transplant team abroad, I'm managing my kidney care, my transplant kidney care very well.
Wow.
Yeah.
Impressive. Impressive. Before we start wrapping up, I'd like our panel to give advice on World Kidney Day, because it's coming up on this Thursday, the 14th, to people out there who, you can look at it from two side points. Those who know, who are walking the path as you do, or those who don't know. What would you tell them, doctor?
For those who don't know that they may have kidney disease, I suggest that they do a basic screening with their general practitioner, which includes a basic blood test to check for the creatinine and the amount of protein in their urine. So those are two basic tests. So we'd start with screening first. And from there, their whole lifestyle management in terms of diet, exercise, everything in proportion. It's very hard if you've been a smoker for many years and for us to tell you to just stop. So, it's a lifestyle change. But first, it starts with screening. Basic blood tests and a simple urine test, early morning urine test.
Understandable. And nurse?
So we encourage everyone to come to this public screening on March 14, 7:30 to 12:30. That gives the opportunity to everybody to be checked and know. Maybe you didn't know you have high blood pressure. So then is when you start becoming to know things and keep your regular checkup. This will be a free of cost. The doctors will be there to review the patient with the normal readings or normal results, and nutritionists will be there to give you guidance. So this is a good opportunity for the public to take and come in and have a check. Persons will be there to educate them, and we want everybody to be welcome. Yes?
Understandable.
From my point of view, my advice would be very proactive and be informed of your health condition. And also be aware of anything regarding your health.
I understand.
Yeah, I mean, it's something that, you have to grasp.
I think if you are aware of something, you can make your change.
Yes.
Right.
Yes.
You have to know.
But if you don't know, you could be doing the same thing for 20 years, and that is detrimental to your health.
Right.
But if you are aware of something, you can make a change.
Understandable. Once again, panel, thank you so much for taking the time to stop by here today. Don't forget, folks, you're listening to Healthcare Today with the HSA. We're talking about the worldwide campaign to raise awareness of the importance of kidneys and their function. The event is happening this Thursday, March 14th, over at the HSA. Inside of the atrium, they will be doing a complete, basically getting to know yourself. They're going to be taking your blood pressure, glucose, cholesterol check. The clinical professions will be there, physicians, dietitians, and also it's a great time for you to stop by and ask any question that you have, because sometimes you're busy and you say, I got a pain and I don't remember, and it only affects me on Thursdays or Wednesdays, but hey, go in and talk to the professionals. It is a great opportunity for you to get a baseline on your health. Thank you so much, panelists.
Thank you.
Thank you for having us.